Now, we spend more money for health care than all the other nations in the world combined. There's 204 nations registered in the United Nations. Of those 204 nations, we spend more money for health care than all the rest. Not more than any nation, more than all nations. And what do we get for it? We rank 92nd in healthfulness in the world. There's 91 other nations whose peoples are healthier than us. We rank 60th in longevity. There's 59 other nations whose peoples live longer than us. And God forgive us, we rank 41st when it comes to live births and first month survivability of babies, and that doesn't even count the abortion piece. Time magazine, December 2008, cover article, The Sorry State of American Health. Despite technological advances in medicine, Americans are less healthy than we used to be, and the next generation, our kids are going to be worse off. How many of you have heard that our kids are not going to live as long as the adults? Okay, that's 2/3 of you. What they're saying here is statistically, 3/4 of you in this room will be standing at a gravesite burying your children, unless we change what we're doing. Petitions of the doctors, petitions of the government aren't going to change anything. That's not going to change anything. There's only one way to change the system, and that is to not use it. Cut off their cash flow, suddenly now they become real humble. But you have to make that decision. Well, that takes responsibility on your part, and I'm here to teach you the things you can do for yourself to avoid using them unnecessarily. That make sense? So that's where we're going. Just so you don't think I made that up, in ranking of newborn deaths, again, we're 41st in the world when it comes to live births and first month survivability of babies, and they say it's a shame. It's not a shame, it's an absolute crime. And most OBGYNs and most pediatricians should go to jail for it. I don't know if you've ever heard of the scientific journal called Food Chemistry. It looks at the nutritional value of food grown here in the United States and food imported in the United States. Also looks for pollution, so I'm kind of familiar with that one. And in the April issue of this year, April 2012, there was a big article in there that looked at 8 very well-known, trusted names in baby foods, Gerber's, Similac, Enfamil, these kind of things. And what they said was that commercially available baby foods contain less than 20% of the recommended levels of many vitamins and minerals, and less than 20%. This is why we have autism and ADD and ADHD. It has nothing to do with vaccinations, nothing. I've looked at the batch numbers, the ingredients, and manufacturers. They send the same batch numbers and the same ingredients all over the world. And 95% of all autism occurs here in the United States. So it can't be the vaccinations because it is used everywhere else. So what is it? It's malnutrition of the brain. You cannot make a good brain on Fruity Pebbles and apple juice. Most kids who have autism and ADD and ADHD are normal until they go from formula to solid food. What's their solid food? Pop-Tarts and Welch's grape juice, Sunny Delight, and Eggos with syrup. All carbohydrates, carbohydrates, carbohydrates. There's no fats, there's no proteins, there's no vitamins, there's no minerals, and you get what you get. You can't make a brain on carbohydrates only. So here's where pediatricians should go to jail. This is from May of this year, cover article in Newsweek magazine. And the first reaction of most people is to have a little giggle because he's a cute little fat kid, a year old. He's clutching his supersized bag of French fries. But this is probably the scariest slide you're going to see tonight, because this is one of the reasons why your kids will not live as long as you. They're predicting already that this kid here, a year old, when I grow up, I'm going to weigh 300 pounds. Raise your hand if you know we're the #1 obese nation in the world. Anybody know that? Yeah, oh, well, good. I don't know, it's kind of interesting line there, and those people don't know. We're the #1 obese nation in the world. The only thing that we're #1 in the health industry is obesity. Now, what does that tell you about the medical systems and the government's knowledge about obesity? They know nothing! Otherwise, we'd be number 204. We should be the slimmest, trimmest, fittest people on earth. But they know nothing about the thing that makes us the sickest people on earth, obesity, and we'll talk about that in a minute. Another little piece here came out the 19th of September, just about a month ago. In 2010, 36% of Americans were obese. 2030, they're projecting that 50% will be obese. Now, what that tells you is they know nothing, because if they knew something, and they could predict what's going to happen in 20 years, they should say, well, it's 36% now, but in 20 years it'll be 20%, another 20 years it'll be 5%. But instead it's going up, which means they have no earthly idea how to stop it. Some states like Mississippi, the most obese nation, or excuse me, the state in America, the most obese right now, they're going to be 66.7%, almost 67% obesity. 2/3 obesity is what they're projecting for. Same thing for Maryland, or Delaware, I guess it is Delaware, 64.7%, almost 65%. And then you're looking at South Carolina, 63%. This young fellow died at 21 years of age of Crohn's disease and a certain type of liver disease called primary sclerosing cholangitis, which is a simple nutritional deficiencies. How many of you heard of Crohn's disease? Okay, Crohn's disease is a simple problem, very simple problem. They say it's an autoimmune thing, and he fought valiantly for 11 years, and then he died. All they do is give him prednisone and cortisone and tell him to eat, give up lettuce and stupid things like that, right? And he died at 21 years of age of complications of Crohn's disease and liver disease. All he had to do was go on a gluten-free diet. We'll talk more about that in a minute. Go on a gluten-free diet, take the 90 essential nutrients, and he'd live to be 121. But when it comes to these things, doctors are either very stupid or they're criminals, because if they know the answer and they choose to treat him rather than cure him, they should have cured him when he was 10 years old in 3 to 6 months. But if they're ignorant, that means they don't know what to do. If they know what to do and they choose to treat him for a long period of time for the money, that means they're criminals, right? And so I'll give them the benefit of the doubt and just say they're stupid, ignorant people.